So I'm going to go ahead and get started. I will give an introduction into me, who I am. First, I want to say that I'm very honored to be here to present and to continue to be of service to anyone that has questions, that's interested in learning more about acupressure and acupuncture and how that can heal traumas of all kinds. My name is Dr. Colleen Curran. I'm a doctor of acupuncture. I'm a licensed acupuncturist. I work in my private practice, which is Zen Path Wellness. If you have questions about my private practice, my website is www.zenpath, like you're walking a path, wellness.com. You can also reach out to me via cell phone, which is 443-417-8692. I'm also...
Wait, can you say your phone number one more time? I'm sorry.
Sure. 443-417-8692.
And you said your website was zenpathwellness.com?
Yes. And if you don't feel comfortable with those two modalities, my email address is zenpathwellness@yahoo.com. Okay. I'm also the main clinician at the University of Maryland Upper Chesapeake Medical Center, specializing in oncology acupuncture, working in the Kaufman Cancer Center. I'm also a faculty member at the Maryland University of Integrative Health, supervising doctorate interns going through the Cancer Center to complete their doctorates in acupuncture. Wow. So that's me. I guess, I could tell the story of how I got into acupuncture and acupressure. I don't really feel that that's too important. I will say that I just felt compelled, after going to college and having lots of different jobs and just feeling like there was something more I should be doing. And I just wanted to get into the health profession. So I wasn't sure which modality. I wasn't sure if it was in the hospital. Massage therapy didn't feel quite like it was a right fit for me. So I basically went and decided to receive an acupuncture treatment and completely fell in love with the modality. I just felt really, really great afterwards. And I didn't really have any symptoms that I was going in for, like shoulder pain or, ankle pain, anything like that. I just was there for the experience. So I researched schools in the area, and it was one of those occurrences where you walk into a building or a room and you just know that's where you're supposed to be. So I went to Thai Sophia Institute, which is in Laurel, and just took the plunge, because it's not like you, if you're really good at doing nails or hair, you can practice on your friends, but you can't really practice placing needles in people. So, well, you could do that for tattoos, but I will say, bringing up tattoos, acupuncture needles are super, super small and thin. They're hair thin, and they're inserted usually superficially on the top of the skin. So if you can handle a tattoo, you can handle an acupuncture needle. So I will say that.
So I have a question.
Sure.
On acupuncture, I don't know too much about it. So I know it's supposed to help. Not the medicine version of treatments, right? So, like you said, you don't want to get too much into it, but what even drifted you in that direction? Like you said, it's rare to have needles. I'm like, no, I'm not gonna meditate with needles in me.
Right. How I was drawn to that, I'm just a really open person. And like I told you before we started the session, sometimes I just kind of fly by the seat of my pants. And if, I feel like drawn to something, I'm like, yeah, let's try it. Let's give it a try. And if there's, something that I don't like about it, I'll speak up. So, that's the part of me being open to things. But if there's any part of the process that I don't feel comfortable with, where you're putting a needle where, no, I don't think so, So, you have that choice and that right to speak up in the moment. So it's your body. So yeah, that's how I was drawn to it.
Come to you open arms, or they're coming to you questioning about that?
Both, both, hmm both. I think the most challenging part for me was working in the hospital and dealing directly with oncologists. So, talking to them about their patients, and they're asking me questions about acupuncture. So I really had to communicate with them on a level that was equal to them. And also let them know that I'm not there, as their like adversary, but like I'm there as I'm there to support. I'm there to support them and their treatments and what they're doing. It's their patients. I'm there to just, supplement. So I'm not going to say, oh, well, you shouldn't have radiation, or, I'm not going to speak against, Western medicine. It's really about integrative medicine. It's about joining the two together.
So more so an option.
Yeah. So if someone, comes to me for depression and, they're taking a medication, I'm not going to tell them to stop taking the medication and just do acupuncture. I mean, that would be irresponsible. But what we can do is work with their doctor to maybe over time, as they keep coming for acupuncture or acupressure, that they're able to reduce the dose so they don't have to take as much. And then eventually they may not need to really utilize it at all. They may just have it as a source, in the moment. If something comes up and they just feel like they need a little extra boost, it's there as a support, if that makes sense.
We had 3 more people join us as well.
Okay, great. So we were just talking a little bit about acupuncture, acupressure. Welcome, everyone. If you missed any part of that, it was just nothing too important. I just said who I was, and you can watch the recording later. So any questions from anyone so far? Good morning. Okay. So if anyone, has anyone had acupuncture or acupressure or experienced that before? Who's just joined? Oh, great. So would you like to share? Yeah, anyone who would like to share some thoughts. I know you're probably typing. I'm used to a Zoom with everyone, so I can see everyone's face and then we can talk. Okay. Yeah, that's where I got my doctorate in acupuncture from MUIH. Yep. Mm-hmm. Heel pain, difficulty with heel pain. And so if you can share what you noticed after treatment and how many treatments. She used the word amazing, so 2 treatments. Did the needles, were they painful?
Does it vary on a treatment?
Yep, she said. Does it vary in regards to how many treatments you would need, or kinds of how many you need?
Person, right?
Yeah, it depends on you individually. And it also depends on how long you've had it. So if it's something that you've only had short term, then it might take a little bit quicker to clear up. as opposed to something that you've had for 10, 20 years. And then also it's good for us all to think about if it's something structural that needs a Western intervention, then, acupuncture can only go so far. Like acupuncture is not going to fix a broken bone. You're going to have to go to the hospital for that. Or, you need back surgery, or, acupuncture can help prepare you for the surgery. It can help reduce the pain. It may be able to help alleviate it. And it can also help you recover quicker after a surgery. It basically, like I said, it's supposed to support whatever you're doing. It's a support system. So, it shouldn't be used, it should be all integrative. That's how I personally feel. And, if you choose to just have acupuncture or holistic services in your life, then, I support that. And if you want to have Western interventions as well, I support that. So, it's to each their own. Anyone have any other questions or have anything else to share about acupuncture? Thank you. Yeah, so I'm a faculty member at MUIH, and we're able to offer complementary treatments to oncology patients at University of Maryland, Upper Chesapeake. So they do have programs through MUIH where you can receive complementary treatments. So that might be a good avenue for everyone to explore. And it's muih.edu. I'm not sure the status of the in-person clinic right now, but I know that they're doing quite a bit of telemedicine. So they would be utilizing acupressure through the telemedicine, and they might be doing some other modalities as well. So that's something to look into. Anyone have any other questions before we get started? Well, I mean, we've started, so we'll see where this takes us. Okay. Okay, so should we begin maybe just kind of, I like to present things into explaining how something works. So I'm just going to briefly talk about how acupressure and acupuncture work from a scientific perspective and kind of ground it in knowledge that we all have, what we like to call body wisdom that we all have. So, all right. And also, we should probably provide a link to trauma, how this all links into trauma. So trauma is, the definition of trauma, one definition I found is deeply distressing or disturbing experience or a physical injury. Okay. So a traumatic experience, to me, I perceive that as an experience that's almost imprinted, or it becomes ingrained in your mind and then also your body. You could have, flashbacks, even talking about it, thinking about it. I know people that have been in car accidents, it takes them a long time to get back, behind the wheel. If they're in a situation where, they were hit from this side and that they're in that situation again, their body starts to tense up. It's almost like they're reliving that moment. Some people could call that, a trigger. I really see triggers as opportunities. It's like we have a choice in that moment. It's an opportunity for us to really, take a pause, take a moment, and I'm going to try and tie this all in together, take a moment to actually breathe. So when someone says they're triggered, I'll ask them, well, what does that mean when you're triggered? What do you feel in your body? What are you feeling in your mind? And then we have that opportunity to stop, take a deep breath, and then make a choice in how we're going to move forward. Are we going to go outside ourselves and reach for something to help calm us? Is it going to be beneficial? Or is it going to be negative? Is it going to have a negative impact on us? So does that resonate with everyone? Please let me know if I'm not clear. Okay, thank you. Sometimes I can kind of, go off into the atmosphere a little bit. So with that being said, okay, now I'm going to explain. So we understand how traumatic events occur and then what happens to us after that, and then how it manifests or how it presents in life. So now I'm going to tie that in with how acupressure and acupuncture work. So endorphins, hopefully everyone's familiar with endorphins. You can experience endorphins as like you feel like, oh, just euphoria, you're just in heaven. You just feel so good in your body. It's just a euphoric feeling of wellness and well-being. Endorphins, so they're neurotransmitters, they're actual chemicals that are produced by the central nervous system and also the pituitary gland. So they are released in response to acute or extensive trauma. So when a traumatic event happens, these endorphins are released. The body is reacting in the moment. That's just a natural reflex. So this can also happen when you're exercising, or when you're just experiencing some highly pleasurable experience, whatever it may be, listening to a good piece of music, having something, to eat that you really enjoy, that you're able to savor. So this is all happening in the moment. So you have endorphins from pleasurable experiences and then also from traumatic experiences. So that's being released. So we have studies that show that acupuncture and acupressure are linked to producing higher levels of beta endorphin in the blood. So that means by applying pressure to the skin and then inserting a needle, that same process of endorphin production occurs. Is that resonating with everyone? Okay. I try to take the science and make it digestible. I know I need that myself. So that explains why acupuncture would be good for reducing pain and aspects of the release of endorphins. So the feelings of euphoria would be linked to why it's recommended for stress relief and for helping with the emotions. And also, some people ask about appetite. So it helps to, that's why it's recommended for regulating nausea in oncology patients. The release of sex hormones, the enhancement of immune response. Okay, that's why acupuncture is good for immunity. And massage and meditation, those two also are really, really good modalities for endorphin secretion. So that's, from a scientific perspective, that's how it works. Yes, is acupressure and acupuncture an ancient modality that was developed centuries ago? Yes. It's very complex, and there's science to support it. We now have the science to support that. It isn't just this kind of huge unknown. I mean, there is a lot that's unknown, believe me. I could practice the rest of my life and still not know everything there is to know. I will never know. I will never know. And I'm fine with that. I'm fine with, my brain can only hold so much, but I'm fine with that. But yeah, so now we have the science to support all of that, that we don't, not all of it, but a good portion that we don't know. And that helps to kind of balance and bring everything, make it more tangible, like something that you can feel, that you can trust in. And this has really helped me be able to talk to oncologists who are, okay, well, I'm sending you patients, but what are you actually doing? So now I'm going to show you how you are your own natural instinctual practitioner. And so I'm going to give you an example of, it's called the gate control theory, but I won't get too far into that. Where you're going to think of, well, I'm going to take you through it. So an example of endorphin secretion that happens automatically and a reflex that you all have. Think of the last time that you hit your funny bone. I mean, everyone's done that, right? If you haven't done that, then like hit your knee or bumped something. Okay. What was the first? Go ahead.
Somebody wants to know a little bit more about the gate control theory, though, when you started touching on it.
Okay. So I will say I like the gate control theory. That's what I chose to explain, but I'll explain it from a scientific perspective. So basically, pain is transmitted through small nerve fibers, from the skin that connect to the spinal cord and the brain. There are also larger fibers that send signals to the small fibers to prevent the pain sensors from signaling. Right. Okay. So when a pain, and I don't want to, so I'll take you back to the bumping your funny bone and hitting your knee real quick. And then I'll explain that. What is the first thing that you do or that you did besides maybe cursing or yelling? There you go. Perfect. That's acupressure. That's acupressure and that's acupuncture. That's essentially, so when a painful stimulus comes in the small nerve fibers, they overwhelm the larger ones. Okay. So then the pain gates open. That's when you hit it. It's like, ow, okay. The pain gates are open. Now by holding, or using an puncture needle or, AccuSeed, then that stimulates the large nerves, quieting the small nerves. So that's the rubbing. Okay. Did that resonate with everyone? I can explain it again. Okay, thank you. So you all have that, natural ability. And that's the whole part of my presentation. Self-healing, for self-empowerment. And the great thing about, yes, being able to, so what acupressure and acupuncture help us with. So we'll go with self acupressure because that's what we're focusing on. You want to be able to do this at any time in the comfort of your own home. All it's doing is bringing you into the present moment. So when you are in the midst of a traumatic event, or it could be as simple as someone is just getting on your nerves. And you have a choice. Someone's getting on your nerves. So we're going to help quiet the nerves. Oh, I like that. That's new. Okay. So we'll call getting on your nerves a trigger. Okay. We'll call it a trigger. They're on your nerves. Those are the small fibers. Those are the small fibers. The large fiber is going to be making a choice, stopping in that moment that you feel that the small nerve fibers are activated, taking a deep breath. It just starts with the breath. You could even just stop there. It's a matter of seconds. You could stop there. Just take a deep breath and then see how your body shifts instead of, well, instead of, coming up and up and out and maybe verbally, lashing out, or, it allows you to just stop for a moment and choose how you're going to react, if you're going to react at all. I don't know if you've heard some people say, well, you can react or you can respond. So react, I would say, more is in the small nerve fiber realm, and then respond would probably be the larger fiber. Yeah. So got it. Thank you. I appreciate the feedback. So how does everyone feel about just going through a short exercise? I mean, that is the basis of my presentation, but I would like to take you through a short exercise to show you how you're able to shift your own energy. Yep. Mm-hmm.
Yeah, it's 10:45. I think we have until 11, so we have time.
Okay, this will be perfect. Okay, so everyone just kind of get in a comfortable position if you can. Okay, feet flat on the ground. And you're not always going to be able to be in this meditative stance, but I'm still going to show you how just the breath changes everything. So you can keep your eyes open, you can close them, whatever works for you. Feet flat on the ground. And just kind of, well, actually, go ahead and close your eyes. Let's get into our bodies and see what we're noticing. Okay, so close your eyes. What are you feeling in your body in this moment? I can feel my heart beating. That's what I can feel. Is there any pain? Is there any tension? Is there any unrest anywhere in the body? So we've connected with what's going on in our bodies. And now we're going to take a deep breath. So inhale through your nose. And exhale through your mouth. And inhale through your nose. And exhale. That was only 2 deep breaths. Now, what are you noticing in your body? Anyone notice a shift? And when I say a shift happens, but shift, yes. So it's as simple as that, 2 deep breaths. I think that maybe took 10 seconds, 15 seconds or so. That is the answer between reacting, possibly negatively, and responding later. When you've had some time, tension in your back released. Wow. You're officially a self practitioner. How easy was, we haven't even done that, the acupressure yet. So good work. Yeah, automatically. So it's just all about the breath. And then, right. And then, right. There you go. Yes, less tension in your shoulders. Good work. So it's all about noticing your triggers, whether it be you're at work, you're sitting in front of the computer, or, for too long and you start to feel the tension in your shoulders. What are you going to do? You're going to stop. You're going to take a couple deep breaths. And then you can also use, the benefit is, acupressure is just an added benefit. I will tell you this. Let me look at time. We're doing okay. All right. The added thank you. The added benefit is that you don't have to be a seasoned. I think we go. What's the rest of the comment? I think we go to.
Well, the problem is I think we go too much and never take the time to check in with ourselves.
I mean, yes, exactly. And yes. So even if it's just taking the time, a few seconds to just stop what you're doing. Some people set a little alarm to remind themselves to breathe. But if we can, it's all about utilizing those triggers or tension. Basically what we learned in school, thanks to Bob Duggan, is right. Yeah. Our symptoms are our teachers. So the tension in your neck is telling you something. Your body's telling you something. The anger that you're feeling is telling you something. Right. Yes. This is all within self-care. So we're not having a judgment on whether your anger is good or bad. It is what it is. It's there. So let's at least look at it and say, okay, I'm angry right now. What am I going to do about it? Am I going to react, respond, or breathe and possibly let it go and alleviate it? You have a choice. So when you are actually, okay, so you don't have to be a seasoned acupuncturist, acupressurist, gone to all these schools to practice self-acupressure. Basically, when you feel tension in the area, what are you going to do? Hold it. Hold it and press. And you're going to implement the breath. And I'll show you, right. I'll show you how to do that. So I actually utilize AccuSeeds, which are little raw Vicaria seeds on adhesives. You can actually see one I have right here. This is the point we're doing today. And you can actually utilize them by putting them in place and going about your day so they stay in place for a few hours. I developed the modality AccuSeed Therapy Accupressure, which incorporates these AccuSeeds. So again, if you have questions, you have my contact info. You can reach out to me about it. Okay. So I'm going to take you through a quick acupressure exercise. And if any of you have the little business cards in your in the packets, the packages that you all received, there are 2 little AccuSeeds in there. So this is just the protocol that I'm going to take you through. So everyone get back into position, in that comfortable position. If you want to close your eyes, you can. We're going to engage the breath. Okay. Everyone close your eyes. Let's get into our bodies again. What are you noticing in your body? Your mind right now? Is there any tension? Are there any thoughts or emotions in this moment? Okay. So now you're going to open your eyes. You're going to take an index finger, whatever finger you choose, and you're going to place it in between your eyebrows. Okay? Wherever you feel called to. Okay? Just place it right there. If you want to go up the bridge of your nose, tapping is another modality, but it has the same scientific process as acupressure. Okay? Acupressure has a little bit more intention. Okay, so everyone have their spot, right? Okay. So we're going to take 2 deep breaths. This time, when we inhale, we're going to press. And when we exhale, we're going to release. So here we go. Everyone find your point, get in position. Inhale, press. Exhale, release. Inhale, press. Exhale, release. Okay, so did anyone notice anything from that exercise? Okay. Free. Right. This point connects you directly with the pituitary gland that is connected to, right, endorphin secretion. So we're talking to the mind, we're talking to the brain. Yeah, we're talking to the, the endorphin secretion itself from the brain. So utilize this at any time. Oh, tears. Notice what comes up for you. Be open to what it is, and then let it move through. Yes, you can absolutely focus on chakras. So we have the third eye engaged here. And we also have the crown chakra engaged, but that's a whole nother, it's a whole nother area. But yes, you could do this. If you know where your chakras are, you could press on the chakra, do the deep breathing, and access your chakras. Okay. So that's how you can do that at home. Right? So simple. You can do it at any time. Yep. So I think yep, we have 5 minutes left. So anyone have any closing questions or comments for me before we finish up? My private practice is located in Fallston in Harford County, but I'm a traveling practitioner. So I will go anywhere that I am needed.
I do personally want to thank you for informing me about this because, like I said, I was the one to look at it and be like, yeah, no, I'm not even doing anything like that. But now I'm more like open into it, and I'm actually going to do my research. And like I said, I have an assignment on this, so I'm definitely going to look more into it and contact you as well.
Yeah, if you have questions, just, reach out to me. Everyone, make sure that everyone has my my contact information, any questions at all. Is there another question?
Yes. Do you have acupressure placement for lower back pain?
Yes. So I would say wherever you have the pain, see what it feels like to press on it. Okay. And then there are specific points for the lower back pain, but what I will say to you is email me personally, and then I'll be able to take you through a protocol, because I have a couple more questions for you. Not everyone's lower back pain is everyone's lower back pain. Not one size fits all. So yeah, just email me. And that's zenpathwellness@yahoo.com. So I'm sure.
I put it in the chat as well.
Okay, cool.
And then Rakia says she really appreciates this moment. She's in the middle of work, so she's just thankful that she had the time to join.
Yeah, great. Well, I appreciate you all and having this opportunity, and and absolutely consider learning a little bit more about the AccuSeeds, because that's something that you can put in place and wear throughout your day. They don't have to be right here on the center of your forehead, but they can be in other areas to help you with whatever you're experiencing at that time. Okay. All right. You all are valuable and powerful. Never forget it. Okay.